If you're studying for the knowledge of mental and emotional health competency on the FTCE Health K-12 exam, code 019, this video is for you. Hi, I'm Dani, a certified teacher and test prep expert with Study.com, here to help you prepare. This exam covers many different areas. You'll need to be able to identify mental and emotional health risk factors, evaluate the impact of mental health disorders on the individual, family, peers, and community. So are you ready to get started? Let's go. The treatment for major depression that is considered a last resort is called A. ECT treatment, B. Mindfulness treatment, C. SNRI treatment, or D. SSRI treatment. So here we're choosing the treatment for major depression that would be a last resort, most likely because it has the potential for serious side effects. Let's look at B first. Mindfulness treatment is a type of therapy focusing on becoming more aware and reducing reactions such as stress, as opposed to being a last resort for major depression. C. SNRIs are a common treatment for major depression, but they aren't a last resort. D. SSRIs are a more common treatment, so again, not a last resort. Back to A. The correct answer is ECT treatment, or electroconvulsive therapy treatment. This treatment involves applying electrical current to the scalp to increase electrical activity in the brain while patients are anesthetized. Because the treatment produces seizure activity and can lead to memory loss, it is used sparingly. A student consistently displays symptoms of high anxiety. As a teacher, the most appropriate action to take would be A. Have a private conversation with the student to understand better their situation. B. Discuss these symptoms with the student's peers to understand their perspective. C. Immediately involve the school's guidance counselor. D. Ignore the symptoms, as they're likely temporary. So we're choosing the most appropriate action for a teacher to take if a student is consistently displaying symptoms of high anxiety. A. Since a teacher is not a trained professional in this regard, having a private conversation would not be the most appropriate action. B. The student's peers are also not trained professionals, so this would not be an appropriate action and could also be a FERPA violation. Let's jump to D. Ignoring the symptoms is not an appropriate action. High anxiety can be a very serious condition. The correct answer is C. Immediately involve the school's guidance counselor because they are trained professionals who can assess the student's situation and provide appropriate resources or referrals for mental health support. A student is struggling with anxiety and could benefit from practicing mindfulness. The best resource for this student might be A. A community gardening club, B. The school's chess club, C. A local yoga or meditation class, D. The school's math tutor. So we're choosing the best resource for a student who is struggling with anxiety and may benefit from practicing mindfulness. A. Community gardening can be a way to practice mindfulness, but it's not the most effective option. B. Chess can also serve as a way to practice mindfulness, but it isn't the best resource here. Let's jump to D. The school's math tutor likely isn't the best nor the most qualified resource to guide a student struggling with anxiety to practice mindfulness. C. A local yoga or meditation class is the correct answer. Both yoga and meditation are practices that emphasize mindfulness, relaxation, and stress reduction, which can be beneficial for a student struggling with anxiety. Major depressive disorder is known to be associated with low levels of which neurotransmitter? A. Norepinephrine, B. Serotonin, C. Acetylcholine, or D. Dopamine. So we're choosing the neurotransmitter that major depressive disorder is associated with low levels of. A. Norepinephrine affects the body's stress response and focus. It is associated with ADHD and anxiety more than depression. Let's look at C. Acetylcholine transmits signals between nerve cells, thereby affecting memory and muscles. D. Dopamine is known as the reward center, though it has many functions. High or low levels are associated with ADHD, Parkinson's disease, and addiction. B. The correct answer is serotonin. It is a monoamine transmitter. It is sometimes called the happy chemical because it contributes to the happiness and well-being of a person. Those are a few examples of the types of health questions you'll see. I hope you're feeling more confident. Let me know in the comments if you'd like to see more on this topic. For more practice, check out our FTCE Health K-12 019 playlist. And for even more detailed practice, strategies, and customizable study materials, head over to study.com and check out our FTCE Health K-12 test prep course. Those who use study.com boast a 92% pass rate. Our courses include full-length exams, hundreds of authentic practice questions, and short targeted video lessons specifically developed based on the latest test updates. With our resources, you'll know exactly what to expect on test day. Like this video and subscribe to this channel to get all the latest FTCE test updates. And please leave your questions and success stories in the comments. We'd love to hear from you. Thanks for watching. Happy studying.